presentation is from Nisha, and I'll let you introduce yourself.
Hey everybody, thanks so much for coming. So my name is Nisha Ahmed. I am currently a consultant with the Global TB Institute in New Jersey, and we are one of the CDC-funded regional training and medical consultation centers, and I will tell you more about that in a moment. As soon as I figure out how to make this all work. Let's see.
He's got them for us.
Nisha, alright. You see my name? It's a good thing.
You can go ahead and place that one.
Although I think I'm gonna do it the other way and do that one, the features first. Okay. So F5, is that right?
Yeah.
Woohoo!
Yeah.
All right. So this is a little map of the northeastern United States, and the areas in blue are what the states that the Global Tuberculosis Institute provides services to. So Lynette's going to tell you a little bit more about it, but we are one of 5 federally funded centers in the United States, and CDC funds all of those centers to deliver training to healthcare workers, outreach workers, nurses. We do a few patient education materials and medical consultation for complex cases. And we help people develop their own trainings and materials and do mini fellowships, which means a nurse or a doctor, an outreach worker would come to our center for a couple of weeks, well, between 2 days and 5 days, and really get some in-depth information and training. So in terms of training courses, we do a lot of training outside of our actual building. So we'll go to a TB program and develop a training that's specifically for them. We also work with some other training centers in the US that work in other areas. So ours are TB, there are some that are in HIV, sexually transmitted infections, viral hepatitis, etc. And we have a couple of core courses that we offer regularly, including, and no one will be surprised to know, one on contact investigation, one on nurse case management, and one at TB intensive, which is all the clinical and programmatic aspects of TB. We also offer a ton of webinars these days. The number isn't here, but I think it's probably around probably 20 to 30 a year these days. So, and they are all available on our website, archived. We also develop educational materials, and this is just a sample of them. I actually didn't bring any with me. We didn't bring any with us, but these are some of them that are all available on our website, and you can also order them. In terms of our some of our online courses that are more relevant for the global TB control arena, we have a refresher course that we developed with the World Medical Association. And all of our materials, including this one, are developed using a systematic process, needs assessment, pilot testing, etc. And we was just updated to reflect the new guidelines. So that is available online. I think there may be a link here. There's also, so we started in we also have an online course on MDR-TB that now with the new WHO guidelines coming out is a bit out of date, but some of the core stuff is still helpful. It's also an app available online, except that who has an Apple phone? Anybody? Okay, yeah, so the Apple one, unfortunately, there's some crazy licensing thing, so right now that's not available, but that Android app is still available. One thing that is really cool that we developed is a roadmap for training public health nurses. So again, it's focused mostly on the American scene, but it is an online collection of educational materials that are available for training nurses. So it also, it breaks it into core competencies that were developed by the National TB Controllers Nurses Association, and has core information in each of those competencies. And then the deal with that is that, because it can be a little overwhelming, but either an individual nurse or a manager can sit down with the nurse and select what it is she wants that nurse needs to know for his or her job, and you can create a customized plan with time frames. So that's a really cool thing, and I really encourage you to check that out. This is just an example of a written material. We have a school nurse handbook that is geared towards those working in school settings on implementing TB testing programs in schools. We have a bunch of pocket-sized drug cards. This one is on diagnosis of TB infection, and we, of course, update it to include updates. So we included the new 12-dose regimen and the new guidelines from the American Academy of Pediatrics. Again, I didn't bring any copies. We also have a patient education flipbook, which is used to provide education in a easily understandable, low literacy format. We have a cultural competency newsletter, that is case-based and talks about some of the challenges around providing care to people from different cultures, dealing with beliefs and cultural views of health and health-seeking behavior. So, and one really cool tool, again, so maybe a little domestically focused, are these little multimedia video clips. So these, you can go access them online on YouTube. They're also mobile phone friendly. And there's 3 videos that cover screening, diagnosis, and treatment of LTBI. And in our setting, and probably in some of your settings too, doctors don't like to take a lot of time for training sometimes. So this is really geared to a more primary care audience. And they're cool because you can send the link to somebody. They run between 6 minutes and 15 minutes. And it really just covers the basics, and we've gotten really great feedback and really great distribution of them sort of through social media. So that was a cool tool for us, and we hope to do more of that. So this is our website where everything is available, and I'm certainly happy to answer questions or. No? Great. So then the next thing I'm going to talk about, maybe some of you will have already seen something about or heard me talk about, which is the ethics assessment tool that we worked on at the Global Tuberculosis Institute. I thought I brought a flyer with me, but I must have left it. Thank you, Lynette. Okay, so this is a project that's funded by the USAID and TB Care 2, and it builds on the fact that there is a lot of challenging issues around ethical application of TB care these days in policy and practice. So those things include palliative care, involuntary isolation, protection of healthcare workers, and of course everyone probably has their own issues. Someone mentioned to me at the conference that they felt a big challenge around the ethics of IPT for children, in terms of there's some risks involved and the data isn't may not be conclusive enough, and how do you convince a parent if you're not sure yourself. So those are interesting things. WHO has guidance on it, but it was issued in 2010, but there are new challenges emerging, and another big one is diagnosis of vampin-resistant or MDR TB in the absence of treatment, and obviously that comes with the use of the gene expert. So there's new guidance coming out from WHO, hopefully next year for World TB Day. So we have these 2 tools that we developed. One is an assessment tool for national program levels, and one is a training curriculum. So the assessment tool, I'm just going to sort of zip through this. You can, I'll on the sheet Lynette handed out, there's a link to it, and my colleague Rajita is very tech savvy, and there's a little QR code, so you can scan it too, and that'll take you straight to the link on our website. It's very fancy. Yes, she's very fancy. So you can just download a QR reader. They're mostly free. I mean, they are free. The assessment tool was developed starting in 2012, and the idea was to help programs look at how their program is doing in comparison to the WHO ethics guidance. So in order to develop the tool, there was a desk audit of available resources, and my colleague Rajita did prepare a draft based on the guidance. It was reviewed by multiple partners who you can see here, and it was pilot tested in 2 countries along with our partner Project Hope. And so it was released in 2015, and it has about maybe a 2 or 3 page introduction about why ethics is important in TB, and then this questionnaire, which I'll show you in a moment, which is essentially a checklist. And then at the end of the checklist, there is a summary of appropriate practices for all the area covered. So the deal is it can be used either by an individual. If you run a facility, you can run it. You can look at it yourself, or it could be used as at a programmatic level to see how things are doing either at a national level or provincial or regional. And it may be sometimes it's a group of people, not an individual who would complete it. So that's the link where it's available. These are on the right-hand side of the screen are all the areas that are covered, and those are the ones that are laid out in the WHO guidelines. And then on the left, you can see just a screenshot of the tool, so you can see how it's essentially set up, which is with a question and then essentially check boxes on the left-hand side. So the deal with that is it'll point you in the direction of where you might need to do some more work. where it'll identify where there might be challenges in your program. For example, is there equitable care offered for migrant populations, and are there patient support groups available? Things like that. And there's, is there legislation allowing for involuntary isolation without enough protection of human rights?
So does it describe what you actually need in your program?
So yes and no. So it refers to the WHO guidance has a lot of detail, and at the end of the tool, and it's probably 2 or 3 pages for each question. There's a brief brief summary of what the WHO recommends. So it doesn't say how to accomplish it, but just for a comparison
So
purpose.
It's a companion kind of document to that.
Yeah, exactly.
Okay.
And we will be revising that based on the new guidance as well. And you know what? I mean, obviously, unfortunately, in some ways, ethics is clear-cut. In some ways, it isn't, right? So figuring out how to solve the problems is sometimes a challenge. So we also have a training curriculum that we developed after that, and that was also TB Care 2 funded through USAID. It is intended for healthcare workers, including nurses, doctors, outreach workers, and TB program staff at various levels, to introduce the concept of ethics in TB and to, I have a small typo there, sensitize and educate. It sensitizes and educates healthcare workers. So it's also based on the guidance and the lessons learned from developing the tool. So one of the challenges we had, though, was, it's really supposed to be applicable to so many different settings and so many different types of healthcare workers. So how do we make it useful? A, given that there's no right answers, and B, given that sometimes there's situational things going on in a program, a policy or a guideline that a healthcare worker has to follow. So it's not really up to them to decide how they're going to change things. So we thought about that quite a bit, and we did, again, here in this case also, we did a desk audit and communicated with WHO experts on these emerging issues. So we developed the draft course. We also had it reviewed by experts, including the Treatment Action Group, who provided some really great feedback from a patient and advocate point of view. And we really tried to go very heavy on the activities. So we have, I don't have them laid out here, but we have individual group activities, we have plenary discussions, we have small group activities, and I'll show you a few examples of them in a second. And what we also did was we're incorporating the ethics tool. So when people get to the course, they actually, the first activity is to go through the tool yourself and say, what are some of the challenges that this helps me realize for my program? And then we encourage people to think about those during the course, and then, as you'll see, work on that at the end. So we did pilot test. It was originally a 1-day course. We did it in East London, South Africa, and gosh, it was really amazing. The executive director of our institute, Dr. Reichman, was like, "Oh, people aren't going to have anything to say about this. They're going to be bored." And it was amazing how many challenges people had that really bubbled to the surface. So we heard from them that it really needed more time to talk about it. So we then changed it into a 2-day course. And it has a facilitator-led training guide. So all this is available online, of course, that has everything you need to conduct the course. So it has background on the topics, given that many people are not ethics experts, and neither am I, neither are the people who were presenting the course. So it has some background on it, also who the target audience should be, and adult learning techniques. And information on how to plan the course, select facilitators, and various templates. And then there is both a narrative summary of each module and slide-by-slide notes. And of course, there's all the handouts for the activities and PowerPoints and evaluation tools. So on the right side of the screen is just, again, not for you to read, but just for you to see that for each slide, for each presentation, there's it's set up so that you'll see the slide and then you'll see some notes. I happened to pick one that had a lot of very dense. They're not all that dense. Some of them are just say this, do this, emphasize that. So you also see there's a question there for the plenary discussion. So, for example, this would be something you'd do with a flip chart, a whiteboard. You'd say, do the patients carry costs related to the services and tests involved in TB? And so people might automatically say, no, it's all free. But then if you sort of go through it little by little, so people have to pay for a sputum test, for a DST, for TB medicines, for treatment for side effects. That's something people sometimes do have to pay for, right? So it really helps people to sort of delve a little deeper. And then just at the bottom is another group discussion question. What's the most critical barrier that limits access for your population? So this is just another example of some more questions that would be done either in a group or individually. And this is, again, not so you can read it, but just so you can see, this is an example of the final activity, which breaks down what are the areas. So on the left-hand side are the areas that are highlighted in the WHO guidance, so access to treatment, patient-centered care, etc. So what is the particular component you decide you need to focus on, and what is it that you can do within your actual purview? What are your things you have control over immediately, in 1 month, and in 6 months? And some of those things are, you know, you may not have that much ability, but you could talk to your supervisor or bring it up at a different level. So this final slide is this is just a slide of what it looks like on our website. You see where you can access it. There's also a link to the assessment tool there. So it can be offered as a complete course, or you can select activities to be used in a small group, and you can certainly modify it for your setting. And the lectures can be used just to raise awareness in specific audiences. So we are going to be working on new tools and resources. The WHO will also have some new tools that they're developing to support their guidance. And I'd love to hear from you, but I don't want to do, if there's anyone has any other comments or ideas of what are the ethical issues that you think are most important, but maybe we can save that discussion for the end so that the other presentations can go forward. Unless you think, you tell me.
Maybe we should do it now,
Okay.
just because we're
All right.
fresh on what you said.
I mean, so does anyone have any thoughts about some ethical challenges that you think are emerging that are important to focus on or address, or some way that you could help, and again, since this is a training group, from a training perspective, help programs implement ethical care, programs and individuals implement ethical care?
I was at the ethics workshop that you guys put on the other day, which I really, really enjoyed and learned a bunch of stuff, and I just was sort of smacked on the head with how I need to learn a lot about this. You know, I think I'm ethical, I try to be ethical, but there, like you said, when you delve into the issue, there's all these things that you might not have recognized. And I think as a nurse and a mom and all that kind of, and a woman, those sorts of things, they all play in. But I think nurses are in a really powerful and unique place to bring forward the ethics perspective, right, through our practice and you know, walking the walk kind of thing. So I'm really delighted to have this training available, and that you've set it up to be delivered by people at the front line instead of, you know. So I can't wait to do it.
Excellent.
And I'm just sitting here thinking, I'm going to do this for my World TB Day activity.
Oh, cool.
I'm going to set that up. But that's about the time when the new guidelines are coming.
That is true. So I mean, the revised tool, this course won't be revised by then, but you know what I mean, that overall concepts, it's not as though it's immediately obsolete, right? Because sadly we haven't solved the old issues yet, we've just added some new ones.
But you know, it will be the primer then, you know, this one this year, and then there'll be a whole year to for the new guidelines to have just kind of percolated down. And I don't know how quickly you guys will get on that new curriculum, but I can say when I do the training, we're going to do this, but guess what, there's new ones, and you know, sort of prime them that way. But I just wanted to thank you for the topic, and also just to say that I'm really inspired by it and thinking about how
Thank you, Lynette. You know, it was interesting, just speaking of that workshop, you know, there was someone who said something just very evocative. It was like, you know, it's important to think at different levels. I mean, it's important to think about it in theory and make sure all the laws are there. But, you know, if I have a patient, a woman who comes in with XDR-TB, and she has 3 children, and she's begging me, she needs to go home because there's no one to take care of her children. What do I do? Like, right, as a physician, as a clinician in that moment. And it's, you know, it felt very powerful to me. I sort of, as they were speaking, I could visualize that encounter, right? And people who are desperate, and how do you know what the right thing to do is? So.
Yeah, it just seems like the storytelling and the sharing of the examples, I find those really powerful. Teaching and also learning tools, because it puts you in the moment. And sometimes glosses or shines a light on where the cracks are, maybe,
Yeah, no, I think
and
that's
also
good.
shines a light on where things are applicable
Yeah.
as well. Right? So.
Excellent. Thank you.
Thanks, Nisha.
Thank you, Annette.
I'm just going to send around the sign-in sheet so that I don't forget to do that because I have to keep track of how many people are in here. So here we go.
Okay. So, Nisha, you obviously found a way to move
Oh.
around. Oh, it's just gone off the screen. Like, where's
Got it?
zero? Yeah. Thank you.
Sorry, I was like, did I break it?
Well,
Yeah,
no,
no.
sometimes it just locks up, right? So, technology is our friend.
It's true.
Okay, F5. Okay, so I when I was getting ready to put the session together, I knew there were an awful lot of people that wanted to come to not just the conference, but that wanted to be at this session in particular that couldn't come due to funding and HR requirements and things like that. And so I have offered to do two presentations that they don't belong to me. They're not my stuff, so I'm just the messenger. But I am quite familiar with them, and as is Nisha. So I think between the two of us, if you have any questions about what's in the slides here, we'll be able to answer them. So this first presentation I wanted to go through is on behalf of the Center for Disease Control's Division of Tuberculosis Elimination. And it's a review of the TB education and training resources that are available to anybody through the CDC website. There's at the back of the room these small little wallet cards that have the website on it for you. So if you want to pick one of those up, just pop it in your wallet, and it's an easy way to find it. But honestly, you just go into Google, you write CDC TB, and it'll take you there. You know, it's pretty easy to find these days. So here are a few of the products that are available through the website that were developed at the Division of TB Control. What you can access through their website and through another website that I'll show you in a moment are things like slide sets, educational materials, fact sheets, web-based materials, things you can immediately download, MAT articles, which are articles that you can use yourself and adapt to your own program. If you do any adaptations to these materials, they do ask that you take the CDC branding off of it, just because if it says CDC on it, it has the appearance of coming from that. But some of these are adaptable templates for you. They have expert commentaries available for you that are canned. They have mobile apps that you can put down on your phone, and this is something like the webinars that I think is really taking off. So this was kind of bleeding edge 2 years ago, and they had one, and now they've got several. They have infographics, which I'm not sure if are you guys familiar with infographics? They're just essentially, they're like a poster, but small, usually about this size, or they might be a little larger, something you'd hang on the wall. And they're usually quite visually appealing. They have snapshots of information. There are tools on the internet to help you learn how to make one, and I'd love next year for us to actually do a workshop on creating infographics, because they're a very powerful teaching tool that can be used with all kinds of audiences and in all kinds of settings. But the CDC does have infographics. I'll tell you a little story about this one. It's got an iceberg on it, which I'm not sure how well that shows up, you guys at the back of the room, but I'll just point out this here. This is an iceberg. So I think we've used that as a metaphor for talking about LTBI sometimes, where we've got the diagnosed LTBI incidents up here, but there's all the rest of it that's hidden. So when I was doing my work up in the Arctic, we were trying to put together an infographic to tell healthcare providers about the incidence of TB in our communities. And we thought, what better infographic than an iceberg, because we actually have them outside floating around in the bay.
Yeah.
So we were able to adapt this model by a bit of cut and pasting and Photoshop kind of work, and put our own messaging on it and use it. And it was really well received, because the community felt it was something that was made for them, but it included their information. So I just wanted to point out that some of them are adaptable, some of them are a little harder to adapt, but even just to get ideas about what you might like to put together for your program. They also have a social media presence that's just getting bigger and bigger. I think it was in August, I want to say July or August, that they launched their Facebook page. So you can go on, if you're a Facebook person, you can like CDC on Facebook, and it's specific to the Division of TB Elimination. So you won't get all the CDC messaging because there's lots of it, but you'll get messaging on TB. And it's not, I wouldn't say that you're getting stuff every day, but the messages you get are really helpful. They've been doing a fantastic job of highlighting resources, highlighting bits of information that come out, and I find I put it up on my Facebook, and then my friends and family are liking it and commenting on it. It's been surprising to me because I've got colleagues that are friends of mine on Facebook, but my family's actually get engaging with them, so that's kind of fun. And of course the MMWR guidelines in the middle there, those are the information that's used to guide the content, but the MMWR guidelines of course become out of date, they're errata, they're being updated, so these products are also informed by other guidelines and materials like the WHO and ATS or American Thoracic Society documents and things like that. So the Division of TB Elimination website, they just actually replaced their website. It's got a whole new look. It's really easy to get around. It has a lot more white space than it used to. So if you've been to their website in the past, it looks fresher now, and they've got some just nice maneuverability there. So in depth a little bit more, some specific products you might be interested in is the TB 101 for healthcare providers. So this has been out for a little while now. I want to say 2 years maybe. I think it was just launched before this last TB ETN conference, which I'll tell you about in a minute. But this is an online resource that you can use for your own training. I've directed many other people to it when they say to me, we really need something basic. We have a new nurse flying into the community to do the TB program. She knows nothing about TB. How do we get her up to speed? And I say, there's this great course. You just go on there and you do it. The thing you need to be aware of about with the CDC materials is they are informed by American guidelines and American standards, which may be different than your program. And you will find in this TB 101, for example, there are some things in there that might be different. For example, in Canada, we have a 10 millimeter cutoff for tuberculin skin testing, whereas in the US, I think it's still 15 in the programs that are still even using TST, right? So there's some things that you can't just adopt it carte blanche. You might want to have a look through it before you start using it. But in general, I find it's a great course. People seem to like to do it. Doesn't take a lot of time, and it's the chunks that they've organized into make sense to people when they're using it. Another great resource are the self-study modules. So these can be viewed online. All of these things can be viewed online, or they can be printed off. If you were in the United States, they would send them to you. They send them to Canada. I don't know if they send beyond that, but I was asked to say download and print. So that's the official line. But these self-study modules, it's essentially like a print-based online course. Self-study, do it at your own pace, kind of stuff. They're well set up. They've got knowledge checks throughout. They've got glossaries and things like that. And I had the pleasure of actually working on 2 of these self-study modules, the contact investigation one and the outbreak detection and response one. So that was a whole other level of learning for a TB educator. But people have told me they find these guides quite helpful, and also there's lots of white space on the page, so they're just really nicely set up. Publications for clinicians. I can't tell if we're moving along here.
Coming soon.
Coming soon. Okay, coming soon. And publications for clinicians. The core curriculum on tuberculosis, what the clinician should know, is very helpful for nurses. So don't be put off by the title. It's got all kinds of great information in it. And it is nice to have something that you can refer physicians to as well, or med students, or other allied professionals, radiologists, pharmacy, respiratory therapists, folks like that. So it's also a very useful guide. People like it very well, and it comes in an app, as it shows there. Some products specific to contact investigation. There's a facilitator guide, role play instructions, meeting with contacts exercise. People like to practice that's just one of the adult learning modalities. You can get DVDs, self-study modules, and the facilitator training guide as a kit. It all comes together in one thing. And these materials, I should point out too, they're all pilot tested and adapted. There's a really methodical process that's used to develop these materials. So I use them with a lot of confidence. And although you have to be aware of which audience you're using it with, I find by and large, if you're using it for the intended audience, you're golden. If you want to use it for someone, like I said, the clinician's guide is also good for nurses. You might have to tweak or adapt, but if you're using it for the intended audience, they're well tested and they're well built. Some examples of general public and patient education materials. We don't have any of these to hand out, unfortunately. They're lovely. They're several different topics that are of interest to patients or families or the public, and they come in different languages. So 6 different low literacy brochures that you can download from the website. And if you're, if you're on the continent, the other continent, obviously, you could order them from the division. They come in English, Spanish, Tagalog, and Vietnamese. So some of them have already been translated. And these have been in circulation for a few years now. So they're well tested, and I'm not sure that they've been updated since they were made yet, but I don't know if you know, Nisha. But yeah, they've been very well received, I know, in the people I've used them with. Now this book, has anyone seen the cover of this before? This was one of the original materials that was made by the director, is that Wanda's title?
Yes, I believe so.
So the current director of the TB Elimination, TB Education
Branch chief, maybe?
Branch chief, that's it.
Yeah.
These titles. So the branch chief of the section of CDC TB that does just education and training, this is one of the first materials that she made when she started working for CDC to put together educational materials. It's obviously been adapted and updated, but I just point that out because it's been enduring that long. So these are basic answers that people have said they want to know the answers to and things that they find helpful. So this is a really good one for downloading, printing off, quoting, taking pieces of information and putting it into your stuff. Really great for making new stuff with. And like I say, you can be confident about the messaging and the content of it. It's available in English and Spanish already. So if you're from a Spanish-speaking country, then that might be helpful. You can just go, but you can, of course, have these adapted into whatever language in your home country that might be useful for you. So if you want to order some stuff online, this is what the ordering system looks like. Very easy to navigate to from their website. It shows you a picture of what it looks like, and so you can make sure that that's the thing that you want, because you'll find there are a lot of materials there. And anything that you see, anything that's print-based, you can download and print off at your own site. So if there's a DVD or something like that you want, it might be a little trickier to get one to you, depending where you are. But certainly, if it was me, I would just try. I would order it and see what happens. And they'll either tell you they can't send it to you or they'll send it to you. But certainly the print-based stuff you can print off for yourself. Now this is a really great resource. Who's familiar with the Find TB Resources website? So, a couple of people? Okay. So at the back of the room there's a little screen capture picture of it. And this website I love. Because if you're looking for something, you've been challenged or you feel there's a need, there's something that you want to have, but you don't have the time or you don't want to reinvent the wheel, you can just type it into the search bar and see who's already made that. So this website is what we call a repository or a library of resources. People self-upload their own materials to share. So if you have materials to share in whatever language, this is a multilingual database, you can upload those yourself. They're not vetted in any way, so anything you find on this website, it's not that it's CDC approved, it's just there as a resource to share. But if you type something into that search bar, I'm not sure if we can do a demo of that here, I'm not sure if we're set up for internet, but it's terribly easy to navigate and find stuff. There's all different ways to search for materials, so if you know who wrote it, you can find it. If you know what it's about, you can find it. If you know roughly how old it is, you can find it. If you know that it's a video or a pamphlet, you can search for it that way. So it's a great tool. I've used it lots of times, and I think this website's actually, I want to say 5 or 6 years old, and I'm not sure if it's
a little bit.
Yeah, because I remember when
it might be a little
kind of, Nisha and I we've known each other for a while, and I'm sure you remember, we revamped it a little bit.
Yeah.
So, but it still works very well. And I just point out the highlight that's on the front of the page there that poster is for a conference that just happened in September, the TB Education and Training Network and TB Program Evaluation Network joint conference. It happens every 2 years. It's in Atlanta. Registration is free. You just have to get there and pay for your hotel and meals. There's no food provided. But to be a member of the Education Training Network or Program Evaluation Network, there's no sign-up fee for that either. And you don't have to attend the conference to be a member. And there is material information shared in those networks that might be of interest to you. Even if you think there's no chance that you're ever going to get to Atlanta, I would encourage you to still sign up for it because there's a lot of value to that organization. So we just had our conference. That was our nifty logo for this year. There's also the Find TB Resources newsletter. If you sign up for the newsletter, you get this once a month. It's not going to choke your inbox. It really is just a once a month mailing. They select from among the stuff people have recently added to that repository to highlight products. So as you see at the bottom of the page here on the bottom half, there's sort of 3 boxes there. So those organizations within the last few months probably, because they'll have a lineup of things, uploaded this material and they selected it as something they thought other people would find useful, so they get it highlighted on the page. So if you make something in your program that you're particularly proud of or want to share or think would be useful other places, another reason to submit it, because this is a really good way to let people know about it, that it exists, and to share your materials. So the TB Education Training Network that I was talking about at the conference, the goals of that network are to facilitate collaboration, there we go, share resources, and build skills. So it's a biennial conference, so every 2 years. This organization also puts on free webinars. I think we did 3 last year. And what they were sessions like this where people applied in advance to say, I have something I want to tell everybody about, something I did or something I'm working on. And we had them lined up in webinars. I think we had 3 or 4 presentations in each webinar where people had 10 minutes to tell you what they're working on, and people could see the slides because it was a webinar platform. And they were really, really well received. We also take suggestions for ideas of what to have in the webinars. So again, if you join the network, you can put forward a request for information or webinar on a particular topic, and those can be considered for these webinars that will be coming up. The conference just ended, and just like with this one, everyone's just kind of taking a breath. But we'll be getting into over the next year, because there is no conference next year. It'll be a webinar year where we do this online training for people. Again, it's free. You just log on. It'll be done in North American time, unfortunately. This can be a challenge for some people, but if you can make it, that's great. This is how you join. It's just TBETN, so Education Training Network, at cdc.gov. But if you go to the TB website at CDC, all of this information is there. You can just click and it'll take you right to what you need to do. By membership is open, that just means anybody, anywhere can join. And as I said, there's no membership fees. Just a little note on using the materials. On that Find TB Resources website, there's a tab about adapting materials. So it's got all kinds of great information about how to adapt materials well. So if you're thinking about doing that, you might want to check it out. So here's just some guidance from CDC about when you're adapting or using their materials. Their materials are free from copyright because they're paid for by government funds. So you are free to use them. And like I said, we sort of cut and pasted that infographic for our own purposes. You are free to do that. They do appreciate that you acknowledge that you use the material from them, but they want you to take their logo off of it if ever you change something, as for the reasons that I mentioned earlier. So stay in touch with social media. They've got a Twitter account, Facebook account, and these are just pictures of the types of stuff that you'll get sent from them. Tweets, I guess. So I haven't seen any tweets from them about the conference, so I've been tweeting them, but yeah. Any questions about that stuff? I'll just leave that up so you can see. So it's a great resource. I use it a ton, and that, especially the Find TB Resources one, I find that really, really helpful. And in my work, because all I do is develop and facilitate training, people will often get a hold of me and say, do you have this, or do you know someone that has that? And it's pretty packed answer. Unless I know someone who just, is working on that, I'll say, have you looked at findtvresources.org? And in my trainings, I have some fun. I say, okay, get your pen out, because this is it's hard to remember this website. And it's like, find TV resources. If you're looking, this is, where you find it. So, just gonna check on the time, 2:11. Doing well.